Madam Chair, distinguished delegates, ladies and gentlemen. It is my great pleasure to be part of this important forum, the INCB Civil Society Hearing on the analysis of the trend to legalize the non-medical use of drugs, in particular, cannabis and related products. I have the honor to speak on behalf of Karim and Afridi Welfare Foundation, Pakistan. KKAWF, a civil society outfit dedicated to highlight the role of prevention as a tool against drug abuse, is very concerned on the gradual liberalization of use of cannabis and cannabis-related substances. KKAWF draws attention to this concern since the drug problem is being acknowledged as the biggest public health challenge exacerbated with the onset of the COVID-19 pandemic. In this context, liberalization of cannabis use heightens risk of drug use and drug use disorders. It is of much concern as Pakistan sits on one of the world's busiest drug trafficking corridors, with an estimate of 8.9 million users and close to 5 million addicts reported in 2015, as well as it is home of 130 million under age of 30. For Pakistan, it is an alarming situation as cannabis is the most commonly used drug in the country. And the legalization of this substance, we feel, is further putting at risk the youth population. Same is true in many countries around the world. Given that there is already 275 million people using psychoactive drugs worldwide and 36 million are with drug use disorder, WDR 2021, our apprehension on legally allowing the use of cannabis is growing. This fear is supported by recent findings of civil society review in Pakistan and other countries, which have shown concerning findings of trend on the rise of cannabis use is worrying also as the potency of the drug has quadrupled over the past 2 decades. KKAWF is of the view that such liberalization policies without scientifically supported evidence and adequate monitoring is increasing the use of cannabis and other drugs. Further, there are no findings that show reduction in the safe use of cannabis, which has severe health implications among other negatives. Moreover, most countries have reported a rise in the use of cannabis during the pandemic. These trends confirm our fear that policies are adopted without due research on non-medical use of drugs, especially cannabis, are premature, ambitious, and do not represent responsible practice. It is imperative that relaxed government policies are not giving out the flawed message that the drug is harmless. Currently, liberal policies on cannabis use have encouraged a diminished awareness of the risk associated with cannabis abuse, which will in due time lead inevitably to an increase in drug abuse among young people and entail serious social consequences. Lower perception of drug use risks has been linked to higher rates of drug use, and the findings of UNODC 2021 WDR also highlight the need to close the gap between perception and reality to educate young people and safeguard public health. Without adequate control and monitoring, it is projected that the world may see more car accidents, more emergency room visits, acute psychological distress, cognitive impairment, amongst other health impacts. This will further burden the economy and the response of public health institutions. Pakistan in September 2020 took the fast track and approved the industrial and medicinal use of hemp. with the intent to tap into the multi-billion-dollar industries. Implementing this policy with viable control will remain challenging, and it can send flawed impression. It is clear, it seems, that the world has no capacity to win the war against the drug mafia and its profitable destructive business. KKAWF insists in recommending that the main focus on addressing the drug problem should be on prevention programs by civil society and, most important, major involvement of the government in this prevention campaigns. It is imperative to continue creating a mechanism of self-defense in youth. It is clear, it seems that the world has no capacity to win the war against the drug mafia and its profitable, destructive business. KKAWF insists in recommending that the main focus on addressing the drug problem should be on prevention programs by civil societies and, most important, major involvement of the government in these prevention campaigns. It is imperative to continue creating a mechanism of self-defense in youth. Prevention education programs are extremely important to empower youth. Legalizing the non-medical use of drugs, it is to reiterate the perception that addiction is a human weakness and therefore should be acceptable, which should not. In light of these trends and nuances, it is crucial that policies for non-medical use of drugs, including cannabis, need to be based on both ethical and evidence-based findings. We need to take notice of the trend towards the unsafe use and increasing use of cannabis by not encouraging legislations of cannabis and adopting evidence-based policy which don't send out flawed message on safe use of cannabis and other non-medical use of drugs. Thank you.